Hi, my name is Grace Rowe. Thank you so much for joining us today for another information video about COVID-19. At the moment, there is so much information around about the virus. It can be very confusing for young people, children and adults to know what advice they should be listening to. To ensure that we have accurate information to follow, we will be having a chat with the New South Wales Chief Medical Officer, Dr Kerry Chant, about how children and young people can continue to protect themselves and their communities from COVID-19. Thank you so much, Dr Chant, for joining us.
It's a pleasure.
Recently, we've seen the emergence of the term hotspots be used a lot. Would you be able to explain to us what that actually means?
We've used the term hotspot to identify an area where there's local transmission occurring. And clearly we're in a situation across the vast majority of Australia where we're in that very low level of transmission, with many states and territories probably having effectively eliminated COVID. Clearly there were still some grumbling cases in Victoria, and New South Wales was similarly had occasional cases of local acquired cases, but incredibly low numbers. What we're turning hotspots is when we start to see the emergence of a lot more locally acquired cases. So they start off as a few, and then as you can see, you can get that rapid upswing in cases over subsequent weeks, and that's what we are concerned about. So we define even a hotspot quite early, but that's because we've got that fear that the numbers will start to escalate, and that any time we test cases, there's often a lag. So when we test cases and announce those cases today, they actually reflect what was happening generally 7 to 14 days previously.
Is there a concern that these hotspots or community outbreaks will take place in New South Wales? And if so, how would that be managed?
So we're very concerned about having, a single case. We've often called for the community to come forward to testing. That's to give us the assurance there isn't broader transmission. We're also, for all our cases, looking back. So instead of we look at from a public health perspective, we try and we look at when you were infectious, where you've been and who you could have been in contact with. But now our contact tracers are actually looking at who you could have got it from. So we go back 14 days and we try and look at where you potentially, what we call upstream of your diagnosis, and look at where you could have got it. We want to go upstream in cases and look for where the source, and because that source may have infected you, but they may have also at the same time infected a lot of other people, and we want to break every chain of transmission.
And what should people living in these hotspots do?
So currently in Victoria, people living in the hotspot areas have got a lot of controls on them put in by the Victorian government, and they've changed over time. So if you are living in a Victorian hotspot, I'd urge you to heed the advice on the Victorian government and health websites which tell you what are the restrictions that you put in place. But the concept of a hotspot is that we generally we do things like restrict the type and nature of the activities. So we might limit the number of people that you can have into your home. We might limit the activities you can do. We also might limit the travel you have. So for instance, we might put restrictions that you can only leave the house under certain circumstances, a bit like our restrictions, stay-at-home restrictions early on in our response to the pandemic. Or we might also have travel movement restrictions where we say, please don't go and visit rural areas, or stay within your local community. We don't want you moving outside of it. So there's a range of measures we might implement in hotspot. We might also urge increased testing and have more pop-up testing clinics and sites. And we might do increased education and hygiene messaging in a hotspot.
Social distancing has been in place for quite some time now. Is it still something that we need to continuously do in day-to-day life? Is it still super important?
Absolutely. Social distancing, that 1.5 metres, wherever practical, we really urge you to socially distance. That's going to be something we're going to have to do, and I suspect that we're going to be doing that for a really long time. The threat of COVID is going to be with us until we have an effective vaccine, and so that social distancing is essential.
Social distancing rules can be slightly confusing for children in school. When they're in school, they're very strict, but when out of school, it might feel a little bit different. How do we approach this, and what are the social distancing rules for everyday life?
I think that it's important to understand that in schools we have a lot of other layers of protection, and education is critical for young people. And so, for instance, in schools we have increased hygiene. We have measures taken to increase the social distancing wherever possible in school rooms. We have cleaners wiping frequently touched surfaces. We have teachers vigilantly finding any child with a cough or sneeze and getting them out of that place. So you have a lot of additional controls. We know education is very important, and we also know that the data suggests that transmission amongst children in that school setting does not appear to occur as in the same way that it would occur for instance, influenza. So for those reasons, we've set a range of measures to be put in place with schools that strike that balance. We've also put in measures to reduce the interaction between parents, because we're often more concerned about the parent interaction. So for instance, initiatives like dropping your child off and the kiss and drop, and not having those mingling or social activities consequent on the conclusion of the school pickup. So we've really asked the school communities to change the way they manage school and the broader interactions around school. In terms of social distancing when you're out, the social distancing rules don't apply to a household, because when you're out and about, in reality, you're already spending very close time at home. What's more important is that you then don't keep your social distance from any other groups. And we're trying to break those chains of transmission. So obviously we accept that households are going to be highly exposed, and because of the nature of the contact in a household. The only exception to that rule is we still want households to maintain good hygiene. If someone in the household was sick, we'd want them to isolate and maintain social distancing under those circumstances. If you had someone elderly staying with you for a short period of time, again, that's a time we'd urge the household to take those extra precautions to keep that elderly person safe. But in general, we acknowledge that households will be living in close environs. So I don't think that there really is a disconnect in the message. We really do want to get that message around social distancing is critically important.
We're now allowed to have gatherings of up to 20 friends and family. What are some key things that we can do to ensure we still protect ourselves in those settings?
Some of the feedback we're getting from experience in Victoria is that young people perhaps are not recognising and feeling very safe in social networks, and that's actually a real positive, the strength of social networks. But almost they're forgetting that if they have, or any one of them, that group of friends has a cough or cold, it's really important that that person doesn't participate in that gathering, that they exclude themselves, and that the rest of the friends actually really support that behaviour as really positive. It's also important that obviously young people are going to spend time together, and that's important. So don't really message that it's okay if you're feeling under the weather, if you're feeling sick, to not attend those events, and no one will think badly of you for not doing that. So have a very low threshold for not being there. Also urge testing. Whilst you may have a very mild disease, a bit of an itchy, scratchy throat, a mild cough, and might not feel too bad because you're generally young and fit, it's really important that you protect others and get a test, because if we diagnose you, we can find where you've got it from, we can then prevent you from onward transmission. And although I say this in general terms, young people shouldn't be totally complacent, because if a large number of young people are infected, there will be a very small handful of young people who have serious consequences from COVID. It's just that obviously older people and people with underlying health conditions have a harder time of COVID infection and have worse outcomes overall.
So we've seen in New South Wales that there's been an increase in testing for adults, but not for young people or children. Is it still important for this group of people that are younger to get tested?
Absolutely. It's very critical, and it's really critical at this time because with the school holiday period, we've often had experience where people know that they need to get tested because the kids need to get cleared before going to school. That sort of discipline may have not be in play now, so it's critical that any parents out there that have got children, who've got symptoms, get tested. And similarly, that 18 to 29 year group, we really want you, that young adult group, please get tested. I think it's really important for people to understand the importance. You might be experiencing a mild illness, but if we can block those trains of transmission, if we can find where you've got it from, we can stop community spread. And so 18 to 29 year olds and younger than 18 have a key role in keeping us safe. And I know that probably it's because we haven't communicated that message strongly enough about the importance of testing to young people.
And Dr. Chant, what are some key symptoms that would warrant a child or young person getting tested?
So some of the symptoms we'd be interested in is runny nose, sore throat, fever, cough, loss of taste or smell, fatigue. So any combination of those symptoms or those symptoms individually, we really urge young people to come forward. And we know that young people sometimes have very minimal symptoms and also recover quite quickly. So also, as soon as you get those symptoms, present for testing. Testing clinics, on our website, there's quite a lot of information on testing sites near you. There's a combination of going to your GP, go to one of the New South Wales Health COVID clinics, or go to the Commonwealth COVID clinics. So wide variety of choices, and just talk to mum and dad or go online and find the COVID clinics. It's got some good information.
I know that many of my friends and I have plans to travel in 2021. We know that international travel is currently not on the table as a possibility. Do you have an estimate or an idea of when our borders will be reopening in Australia?
Can I just say that's a really common question I get asked.
Yeah.
And look, I think our borders closures have been a really effective measure at protecting us, and I think you'll be aware of the increase in case numbers in many parts of the world. I think that it's probably too early to tell, but until we have an effective vaccine, the threat remains of COVID being reintroduced, and for us to have escalating cases associated with returning travellers or us travelling more widely. So I think that it's probably okay to be optimistic towards the very, very end of next year, but even that may be, I can't give a definitive answer.
Of course. Schools have returned to face-to-face learning, but many universities still remain online. Is there an understanding or an idea of when unis will go back to face-to-face learning?
I think all of the universities have started to consider their approach to the second semester or this next period. My understanding is that they're prioritising those courses or bringing back students that really need that laboratory work or supercomputing or things that can only be done in the universities' facilities, and the rest remaining sort of online. So I think they're still in general pursuing a very mixed model where they're actually really prioritising those groups that are essential for learning to go onto campus to make sure that the density on campus is reduced, and also that students travelling on public transport and the general movement of students is reduced.
We know that this situation of this global pandemic is definitely taking a toll on people. We have many reports of children and young people feeling worried or stressed, having more tension at home. What would you recommend as different ways to cope, or any advice you have for these people going through this?
I'd like to sort of give a reassuring message that I think the Australian healthcare system, the Australian government system is a very strong one, and I think people should be assured that we are closely working together and working with the community to navigate the challenges that COVID's presenting. So I'd just like to firstly give that positive reassurance to the community. The second issue is that sometimes these situations bring us closer together as families and actually galvanise the community. And I've been really, it's heartwarming to see some of the stories about how the community and individuals have supported each other. I think it's a time for families to spend more time together, embrace physical activities and enjoy. Even our winters are very mild and moderate in most parts of New South Wales. So I just sort of say, try and enjoy the environment that we live in, connect with friends. Young people are totally digitally enabled, and I think that's part of your strength, and I'd suggest that you maybe spend some time training the adults with some of those digitally enabled tools. I also think you have a really important role in linking. Young people, I know that there's many people that are socially isolated, elderly people that are limiting visitor numbers, but again, young people can really facilitate through technology and supports how we can connect with elderly people. And I think you've got a key role to play in keeping that community cohesion. So I want to call out to young people.
Thank you, Dr. Chant, for your time today. It is really important to ensure you are listening to advice from reputable sources. If you would like more information about the virus, please visit the New South Wales Government website by searching New South Wales Government COVID-19. If you feel unwell, it is important to tell someone and speak to a health direct or registered GP for advice. It is normal to feel anxious or upset by COVID-19. If you have been affected by the contents of this video and would like to talk to someone who can help you through these uncertain times, please contact the organisations on the screen who can offer you free counselling and advice. Thank you so much for watching today's video, and thank you once again to Dr. Chant for her time today.